The Kalamazoo Community COVID-19 Update is produced locally through Public Media Network. Hello, and thank you for joining us for another segment of the Kalamazoo Community COVID-19 Update. We're very honored to have with us a very special guest. We'll be speaking with Denise Crawford, President and CEO of the Family Health Center. Denise, thank you for showing up for Kalamazoo. It's a pleasure to have you. How are you today?
Thank you so much. It's a pleasure to be here with you.
Well, I'm honored to have you. You know, one thing I've noticed about you here recently is you roll up your sleeves. You get out there with the staff, and what they do, you're out there swinging right along with them, aren't you?
Absolutely, absolutely. All for one and one for all. It's definitely a team effort, and I truly believe in that.
Very good. And you know, as we talked earlier, and I did tell you I have a family member that works for you, and she has absolutely the highest regard for you.
Oh.
So, yeah, I do want you to know that your efforts are truly loved.
Well, thank you. That means a lot. That means a lot. I take it very serious, and you know, Family Health Center is very near and dear to my heart, particularly being born and raised right here in Kalamazoo. So it's truly far more than a job. I do believe that it's, you know, a form of a calling, and I truly love what I do. I have the opportunity, I believe, to work hard and give back, but I truly enjoy it. So thank you for recognizing those efforts. I appreciate it.
Wonderful. Now let me ask you, with this pandemic going, you're seeing a lot of people and a lot of sick people. And that can be very stressful and really wear on your staff. How's the morale of your staff? How's everyone doing?
Interesting, you know, thank you for asking that question. I am at this particular time, in true transparency, I am so proud of the staff. They have truly stepped up and been amazing. You know, particularly on the medical side. So when I look at the physicians, the nurses, the medical assistants, I can honestly say I have not had a single provider who has come to me and indicated that, you know, they don't want to be here, that they're concerned, et cetera. Whereas we have had very poignant and real conversations about the safety and the necessity and the importance of very strict processes to ensure that they're protected and that they have the ability to protect their families and loved ones. I can tell you that these are true soldiers and boots on the ground. They are arriving like, this is what we have trained for. This is what we do. This is a pandemic. We need to be here. We need to stomp this out. And so regularly they come with ideas and suggestions as to how we can address and reach more people and different things that need to take place. But they are armored and ready to go, truly ready to deliver the care. It's very humbling and very, very rewarding to watch.
Well, that's really, it's really something, and you really have to marvel at the efforts, particularly when every day you're putting your life on the line, and they're afraid, they're stressed, but they keep going. And
absolutely.
Yeah, we're very fortunate to have them. Let me ask you, how many patients are you seeing a day? Are you seeing quite a number?
So we are, you know, our volume in general has dropped, which we would expect. We actually want that and have encouraged that, meaning individuals who historically would just come to the center for their routine primary care. We are discouraging that because we don't want to, you know, place anyone at risk or inflict anyone. So we are providing a large number of services via virtual health. So fortunately, we are able to bill for that service, and there are a number of services that can be delivered via video conference, et cetera, via a virtual health platform. So on average, we, in a given day, Family Health Center as a whole throughout the entire enterprise, we would average about 750 visits a day. We are down about 50%. So we're averaging about anywhere from 300 to 350 visits a day.
Okay. Well, I would imagine that a lot of that decrease in visit is due to telehealth And
Absolutely.
yeah, and likewise, you're seeing patients that that are exhibiting risk, or excuse me, symptoms and risk factors.
Correct. So we are addressing individuals who have symptoms. We're addressing individuals who have other, primary care needs. I think, one of the things that I'm equally proud of with the center is that we are one of the very few, if not the only, primary care center that remains open with full service hours to the community. So understandably, many offices, due to, again, volume and due to own personal philosophy, have closed during this pandemic. But obviously, healthcare is something that's very critical and needed. And so those conditions don't necessarily change. And they may be conditions that don't require an emergency room, but you still require the expertise and the support from a medical department or medical personnel. So interestingly enough, we are treating a lot of patients that are not necessarily family health center historic patients, but just patients who need care who do not have access to any other medical provider in town outside of the emergency room.
Okay. Now, let me ask you, in terms of readiness, do you feel the staff is ready? Do you feel like you have adequate supplies, all the PPE you need, et cetera?
Absolutely. So obviously, the has been very vocal about the national shortage, and so we're very respectful of our supplies. But we have worked very closely with the governor. I have to say that her team has been instrumental, and so we are armored with the appropriate PPE. We're so appreciative. We have received it from all various areas and departments, from our associations, from private vendors, from ordering it ourselves, from the county health department, from hospitals. Again, just a true myriad of areas. But we are prepared to ensure that both our patients and our staff are covered, and their safety remains paramount. And so fortunately, PPE is not an issue for us. We have the N95 mask, we have the gowns, we have the goggles, and so we have everyone suited up and covered as appropriate.
Wonderful. Now, let me ask you, I know you're seeing, you mentioned roughly about 350 patients a day.
Mm-hmm.
What do you think is what's in the future? What can we expect for the next 30 days in terms of volume?
So I honestly, I don't foresee our volume changing significantly. I think and I've been saying this since day one, not necessarily me, but the epidemiologists, and I do foresee it coming true that we in Kalamazoo County as a whole have not seen the true surge of the coronavirus. I truly believe that our surge is on the rise now as we speak, and we anticipate that around the first week of May is when we will peak. So it is at that point where we believe, as we refer to it, that we will see the true highest component of the bell curve. So you will hear speak a lot about flattening the curve, and a lot of the stay at home and a lot of the efforts centered around, stay home, stay safe, et cetera, was centered around flattening the curve. And some of those efforts have been true in our county, where I think that has been relatively successful. We did not have the appropriate or the necessary, maybe some would say, testing abilities or testing equipment. And so we did not do a significant amount of testing in Michigan as a whole, but definitely not in Kalamazoo County. Now that we have access to that, I think we will be able to get that information out. And so I think what we're going to see is that it is a much higher concentration than what we were made aware of. And so I think we'll see our highest numbers of individuals infected actually with the disease as we enter May. Our actual county medical director refers to it as the tsunami. And so in the element of the tsunami is kind of stirring. And so in that week, we believe, based on a lot of the epidemiological data and what we're seeing, that week is when the tsunami will hit. And then we'll start to see the curve where we'll start to actually get on top of it and start to, see a lot of these services, a lot of these numbers actually start to decline over time. But it's going to be with us for a while. Again, that's my belief. I don't have a silver ball. I'm just in it and working in it every day. But I think the largest component will come in May. And then as we enter into the summer, whereas it'll still be with us, we'll start to see that decline and start to dissipate.
Okay, now that's interesting. You feel that like we will peak in May. I would guess that means that you're not, you don't support the various states that are trying to reopen their states and the cities.
I think that's very challenging. I mean, I think that's on an individual basis. I know our governor is very much concerned about the economy, but she's equally concerned about health and wellness and safety. I think for Michigan as a, we sit in a very different place. Michigan, currently, when we look at, the coronavirus nationally, we know that there's approximately 763,000 cases throughout the U.S. and about 40,500 deaths. For Michigan as a whole, we have about 31,000 cases and about 2,391 deaths. What's interesting for Michigan is that we sit number 3 in the country for deaths. So we are right behind New York and New Jersey. And I think we all know that Michigan does not begin to have the populace of people as New York and New Jersey, yet we are number 3 in total deaths. So that really plays into our, I think a lot of the efforts centered around the stay home and stay safe. The other thing about Michigan, which really speaks to a lot of our work centered around the testing as directed by the governor, is that Michigan is last in the country for actual tests performed. So whereas we are 3 in the country for deaths, as far as providing the test and actually testing individuals and getting that information out there and making the public aware, we're number 3. And so what that tells us is that we just have to do a lot more testing in order to make good, solid decisions. We need good, solid data. And so that's where some of those efforts are truly being derived right now. Is trying to ensure that we can get the information out to people and make them aware of their status so that they then themselves can self-quarantine, can make sure that they're protecting themselves and loved ones. One of the key components that it's important to keep in mind, because we talk about the devastation associated with the coronavirus, and that's true, that's real, because we don't know a whole lot about it. It's very new. And so as far as the treatments and the tests and the vaccines, we don't have vaccines, we don't have medications. And in the healthcare, that's very, challenging for us. We typically have a good handle on things, and we can give you this and give you this remedy and send you home and monitor and see how things improve. With this particular virus, we don't have that yet. The beauty is that 85 to 87% of the individuals that contract this virus, they do just fine. We go home, we say to isolate, to self-quarantine, to monitor your symptoms. We make you aware. You may feel very tired, very lethargic. You'll experience this, do this, don't take Motrin, do this, etc. And people, by and large, over the 14-day period, will completely recover.
Wow.
87% completely recover independently.
Well, it seems that clearly testing is paramount. You mentioned
Absolutely,
that,
we believe.
but you mentioned that in the lab. What does it take for us to increase our testing to ensure the safety of all of our citizenry locally?
So part of the challenge associated with the testing was the testing supplies. So we just did not, nationally, we did not have the supply. So you may have heard and referenced that there was a significant backlog on PPE, So we didn't have the protective, historically, we didn't throughout the country have the protective equipment to protect the individuals who would be caring for those with the disease, to protect themselves from contracting it. So that's a big, major one. And then two, we didn't have the testing supplies or the testing kits. For Michigan, and again, we significantly didn't, and our governor, again, we were the last in the entire country to admit, as far as administering state testing, getting the information out. Our governor then did go to work. To her credit, she established a contract with a lab here in Grand Rapids. She was able to solidify that relatively quickly. She got us testing supplies, and she gave us essentially directives to get out and test. So that was the result, and all of this happened in very short order. So our most recent testing event at Stone's Church was a direct result of that. The testing unit was able to provide us with 100 samples, a little over 100 samples. Our goal was to test 100 individuals. We scheduled 125. I am so proud of my team. My phenomenal team was out there. We decided to have a Michigan blizzard in the middle of April, but my team was stocked and ready to go. We tested 117 individuals. And interestingly enough, 23 returned positive. So about 20%, which is pretty high. Now that's a pretty small sample of 117, but that was our first event. So our next event will be this Thursday, April 23rd at Laura Norris High School. And at this event, we will test upwards of 300 individuals. So again, we have been given the testing kits, and we'll be prepared to test 300 at Laura Norris this Thursday from 8 a.m. to 4 p.m.
Wow, that's quite an increase. Now, a couple questions that I'd like to toss out to you is, one, we hear a lot about testing and testing kits. If you would, kind of give me the difference between the two so that the viewers can understand what that means. But along with that, if you would, talk about the testing process. What does it mean? What entails being tested? Is it a blood sample, or is it a swab, or is it both? How do those work?
Absolutely. So currently, the FDA regulated test, which is what we use, is a nasal swab. So in general communication, when we were talking about testing kits, etc., it all means the same thing, and it's all, quite honestly, pretty nebulous. What we are truly doing is sample collection. The general public doesn't necessarily understand or refer to that, so we simply tell them a COVID-19 test. But what we're truly doing is we're collecting the sample to then send to the lab, and the laboratory actually performs the COVID-19 test.
Now, is that sample a swab, or is that a blood test?
Correct. So the sample which we do, which is the FDA Federal Drug Administration approved sample, is a nasal swab. So what takes place, it takes all of about 4 to 8 seconds maximum. What the certified medical staff does is they will open up, it's a completely sterile package. It looks like, to the general public, it would look like it's not a Q-tip, but probably that's the closest thing in which it resembles, is a very long Q-tip. It's a long, we use these swabs all the time, but it's a long swab, and it resembles most closely to a Q-tip. And so they will ask you to tilt your head slightly to about a 70-degree angle, and then they will swab your nose, one nostril at a time. So they will take one Q-tip-like device and swab your first nostril, and then they place that in the shipper very close, carefully, and then they will swab the second nostril, and they'll place that in the shipper very carefully, and then package that all up with your lab information, and then they ship that off to the lab, and the results come back within 24 to 48 hours. We've been receiving the results relatively quickly, and so it's been a little under 24 hours, but of course we tell people within 24 to 48 hours. So once the results, then they go to the lab. The lab is actually in Grand Rapids. So a courier picks those up, couriers them to Grand Rapids. Then they go into a whole laboratory process, and they're processed and they're, validated, et cetera. All of that piece takes place. And then they send us, as well as the state, as well as the health department, because again, this is a pandemic. We all receive the results of the test.
Wow, that's interesting. So you're getting results in 24 hours.
Yes.
That's
Yes.
excellent. Now, here's another question. Even though many of us are, and most of us are adhering to the stay home order, we are, we're kind of forced to go out for groceries, et cetera. Now, every time I come back, I feel a little apprehensive, a bit of anxiety about as to whether or not I've contracted the disease or the virus. How can I get a test? Can everyone, I'm hearing that anyone that wants a test can get a test. What do I need to get a test? Can I just walk in and get a test?
So no, not necessarily. There are not enough tests for that yet. So what we're testing right now is essential workers, and then individuals who have symptoms or mild symptoms. Now they place it in categories. And so there's category 1, which are the strictest, which are, age, complexities associated with other illnesses. And then there's, if you live with individuals who are compromised or more senior, or you work in, a healthcare industry, et cetera. So there's various groups, group 1, 2, they call them tiers, tier 1, 2, and 3. They have just released that to the lowest tier can be tested. And those are individuals who have mild symptoms. So if you have a mild cough, if you have a mild, nausea, something associated with it, even to a mild degree. Historically, we were not tested. We can now test you. Also, all essential workers, which is very new. So that's anyone basically who is working now and interacting with anyone in the public. We can test you. So they have loosened them significantly. I do believe the time will come where anyone and everyone will be able to have a test. They have not released it to that degree, but it is significantly released. It still is a medical process. It is a medical laboratory, and so it does have to, there's a doctor's order to obtain the lab. So we have simplified the process. We have a COVID-19 hotline, so I'm looking over here for it, and it's 264880804. And again, that's 269-488-0804. And our process is streamlined. You simply call that hotline. They will register you, get some demographic information, and then forward you directly to the physician who can do the medical status exam. They're just going to make sure that you're stabilized. They will then assess you. All this happens virtually over the phone. They will assess you and assess your symptoms to see if you're appropriate for the test. And if so, then they'll order your test virtually right online. Everything is set up, and then they'll give you your time to arrive for your testing.
Wonderful.
And it happens relatively quickly.
Does that number go right to the Family Health Center?
Absolutely. Right to Family Health Center and directly to registration. 269-488-0804.
Okay, I'll make sure we have that up on the screen. Question for you. Nationally, we've talked about how the virus is adversely affecting the African American community. What's your experience? How are you seeing that manifest itself?
So it is very significant, particularly here in Michigan. It is, addressing African Americans at alarming rates. We're extremely, concerned. I was just going to share the most recent statistics with you. And coronavirus, African Americans currently in the state of Michigan make up 40% of the deaths associated with the coronavirus. Similarly, African Americans make up 34% of the individuals currently diagnosed with the coronavirus. Yet, African Americans make up 14% of the total population in Michigan. So it is a significant disparity. Here at the Family Health Center, we are very much aware of that. And so we are, informing our providers and ensuring that they are monitoring this very carefully, very closely, with all their patients, but particularly with their African American patients and their Black and Brown patients, because of what the data is telling us. The data is very clear. This virus is very new. And so in addition to all of the, disparities associated with health, it's unfortunately unraveling a lot of the other challenges that African Americans face, particularly with it being so new. And so we are devastated at best. This is extremely alarming. This just hit the States. And for African Americans to comprise 40% of the total deaths in Michigan, and I just shared with you earlier that there were about 2,300 deaths, I believe, in the state of Michigan. And almost half of those have been African Americans. Yet African Americans only make up 14% of the entire population. It's alarming. So much so that the governor has assigned a special task force just to look at what exactly is taking place associated with these racial disparities.
Wow, and that's quite a difference. And I would imagine that one thing that we haven't talked about, we talked about symptoms, but in the African American community, we have a higher number of risk factors. And I would imagine that plays a significant role in the increased number of deaths. Are you seeing that as well?
Absolutely. We know that any multiple complications or previous comorbidities associated with the virus significantly increases your complication and lessens your chances for recovery. So someone who already is compromised because of diabetes, if they've already had congestive heart failure, particularly if they have diseases associated with respiratory problems. Smokers, very challenging. Just a lot of behaviors, kidney problems, a lot of already complicated conditions can really, really affect or exacerbate the effects of this virus. And that's the other thing. It's a very fast attacker that we haven't been able, again, because we don't know enough about it. It's very hard for us to get on top and control it. So people die relatively quickly.
Wow. Well, one of the things that I'm seeing that is becoming a characteristic of the Family Health Center is that you're attempting to address all of these risk factors.
Absolutely.
And I've seen that with telehealth and certainly the drive-through testing and video visits and the SBRIT clinic, and even client referral specialists. So those are wonderful things that I'm hearing about and reading about with the Family Health Center. And certainly that is a lot of due to a lot of work that you're doing. But if you would, tell our public, tell the viewers a little bit about those, because that's information that we need to know, not only for the virus, but also for general health. And you're leading the community in addressing those issues. Talk to us about that, if you would, please.
Absolutely. So we take it very serious. We exist to ensure that all members of our community have access to quality health care. And so we take that in a very, focused approach where we partner with individuals, and essentially we describe that as we meet you where you're at. And we try to provide or position you to a one-stop shop, which is how we oftentimes design it. And so you will come into the center and you'll have your primary care physician. And if you need diabetic education, or if you're chronic diabetic, then we make sure the diabetic educator is right there. So we're not referring you out, which is common, to another location or to an office in hospital where you can go and get your diabetic education. If you need behavioral health services, which is very, very common, individuals can be overwhelmed with just all of the complexities associated with living with disparities. People can have food insecurities, people can have domestic violence issues. There can be a myriad of challenges that individuals are facing, from housing to childcare, again, on and on. And so we have licensed behavioral health specialists that are part of the care team. They enter there. It's not like you have to go down to the mental health department, down the hall, etc. We neutralize the entire process. And so they're part of the medical care team. As soon as your physician completes his visit, they enter right into the exact same exam room. And they come in, they introduce themselves, and then they meet with you briefly. If things are going well, they applaud you. They can tell you, continue on your way. Let us know if there's anything we can do. We're here. But if there are challenges, then they make sure that they connect you to those challenges so that you can get that additional support. Similarly, we do have we make sure that we provide the SBIRT to all members, and that is the structured brief interview and treatment survey. So we know oftentimes within our community, there's a large preponderance of substance use and or abuse. And so what this is able to do is it's a universal screening tool, very quick, very limited, but it will help us understand if we need to go to any further support or interaction around any type of substance abuse, via alcohol, via controlled medications, via street medications, etc. And so we administer that to every patient at least once a year. And then it's amazing the number of individuals that we're able to assist as a result of that. People are very honest. We're not judgmental. We don't consider it a judgmental process, but then we're able to connect them. We have substance use clinics. We have treatment clinics that we're right here on staff. So again, we try to make it a full service process. Of course, you know, we have the pharmacy. So we have the full service pharmacy. We have full-time occupational therapy, physical therapy. We have OBGYN on service on site. We have cardiac. We have gastro. Of course, we have primary care. We have pediatrics. So we ideally want to be in your community for you. We are here to serve you. And we want to make sure that you have access. Our normal hours, as you know, are very expansive for the community. We're typically open Monday through Friday, 8 to 8, and then Saturday, 9 to 1. Of course, we tweak those for COVID, but we provide those expanded hours again so that we can meet the needs of the community.
Wonderful. Now, there are 2 centers under your leadership now, correct? You've got the one on the north side.
Right. Well, we have 5 locations, but yeah, two main flagship locations. So the Alcott as well as the Patterson.
Okay. And do you have any plans for future locations?
So not at this particular time. You know, when we built the second one, so our data, obviously we work very closely with the federal government, and we monitor the needs, particularly for our target population. So at the time that we built the most recent facility on Alcott in 2017, the need at that time was 62,000. And so when we constructed this site, coupled with the Alcott site, we were able to we built it to serve 70,000 patients. Currently, we have 43,000 active patients. And so we definitely have capacity for growth, which was intentional. But we believe that we have the ability to meet the need. So if the need grows, we will absolutely grow. But right now, we're in a good space. And so we won't be building a lot. We'll definitely always have new opportunities and new services and looking for new ways to partner with the community. But as far as actual construction projects, we're in a pretty good space right now.
Very good. Well, one thing I know for certain is that the public is really being served well by partnering with you. We certainly appreciate all the work that you do, and certainly your staff is the mirror image of you, because it's very warm, it's very non-judgmental, and very accepting for patients that come in. I know that firsthand because I've walked in and toured the facilities.
Good, good.
We certainly thank you. I don't want to hold you because I know you've got a number of things to do today. But likewise, I certainly thank you for your time, and I thank you for doing what you've always done, and that's showing up for Kalamazoo. All
Thank
right.
you. It's my pleasure. Thank you. Definitely an honor. Thank you very much.
Well, the pleasure is certainly ours, and I know that we're in for a long ride. I'd certainly, as I've said in the past, I'd love to come back to you and have another conversation as we work through this pandemic.
Okay, sounds good. We'll be here.
All right, ladies and gentlemen, thank you for viewing. This is Clifford Brown, and I thank you for showing up for the Kalamazoo Community COVID update. Have a wonderful day, and we'll be back with you soon.
The Kalamazoo Community COVID-19 update is produced locally through the Public Media Network. Our goal in this and subsequent broadcasts will be to provide you with the most up-to-date local information concerning the health of you and your family throughout this most devastating pandemic. Our community is braced and consistently preparing to handle the medical, emotional, and social needs of our families and friends. Please adhere to the advice of our governmental and community leaders. They are working tirelessly to provide you with information that will make a difference. Our broadcasts are likewise poised to provide you with updates of when and where you can find essential resources. We hope you'll receive this information with the care and urgency necessary to keep our communities thriving. Please be safe and make wise decisions.
Hi, I'm Zach with PMN, and we're going to go over how to practice good information to combat the COVID-19 virus. Something that we must do in these times is practice social distancing. Avoid gatherings of large people, keep your distance, and know that there are safe activities that you can do, such as taking a walk or a family game night. Here are 5 tips to double-check COVID-19 information online. Some stories are too good to be true. False and misleading stories spread because people share them. Not all research is created equal. Verify images with reverse image search. Verify videos with thumbnails and InVid. Use geolocation to determine where a photo or video was taken. Help is also available. For emotional support, call 269-381-4357 for the local crisis hotline, or call 1-800-273-8255 for the National Suicide Prevention Hotline. More information can be found on our website at publicmedianet.org.